Tara, my name is Amy and I'm going to be your nurse today.
Hi.
So can you tell me what brought you in today?
My annual health screening.
Okay, so I'd like to just start out by doing some orientation questions. Can you tell me what state we're in?
Missouri.
Okay, can you tell me your full name?
Tara Lynn Tribune.
Okay, can you tell me your date of birth?
2988.
Okay, so are we currently in a shopping mall, grocery store, or a made-up clinical office?
Clinical office.
Perfect. Okay, so the next thing I'm going to do is I'm just going to assess your head and neck for symmetry, okay? So I'm just doing a visual inspection. I'm just going to take a look at your neck, tilt your head back slightly, and swallow once for me. Okay, can you smile for me? Okay, now frown. Okay. Okay, so the next thing that I'm going to do is I'm going to just palpate your skull and look through your hair, if that'd be okay.
Okay.
Okay, so we would want to move through the patient's head from the front to the back, and we're just palpating for any masses or lumps. Have you ever had any head trauma?
No.
No? Okay. And so then the next thing we're going to do is we're just going to look through the patient's hair and make sure that it's clean and healthy, which hers is. Okay. So the next thing I'm going to do is I'm going to palpate your sinuses, okay? So I'm going to just touch on your face. I want you to tell me if anything I'm doing is tender or hurts, okay? Do you have any pain there?
No.
Okay. So, let's see. The next thing I would do is I'm going to just palpate your neck for your lymph nodes, okay? Normally lymph nodes are not felt. Sorry, my hands are just a little cold. Any tenderness, anything that I'm doing?
No.
Okay, good. And I can't feel your lymph nodes, and that's exactly what's expected. So the next thing we're going to do is I'm going to assess your thyroid gland, okay? So, with this being said, I have a little bit of water right here. I'm going to have you just take a sip of water, tilt your head back just a little bit, and swallow, okay? Okay, good. Now I'm going to have you do the exact same thing, and I'm just going to lightly place my hands on your thyroid, okay? Perfect, okay. Okay. So the next thing I'm going to do is I'm just going to palpate your thyroid, okay? This should not hurt. Okay, good. Any pain? No. Okay. So next we're going to palpate your trachea. We want to make sure that it's midline, so tilt your head back just a bit, slightly, okay? Okay, trachea is midline. And then at this point in time, we would just do one final look over of the head and the neck to make sure that everything is symmetrical. Tilt your head back just slightly one more time. Give me a nice swallow. Okay, so we're just assessing the jugular vein and also carotid arteries, which you would want to palpate one at a time to feel for the pulse. And everything is good. So the next thing that we're going to do is we're going to assess the nose. So first we would start by visual inspection of the outside of your nose. We would want to make sure it's symmetrical, which it is. It's the same color as the rest of your face, which is normal. That's what we want. I'm going to lightly just touch your nose. Tell me if anything hurts. No?
No.
Everything good?
Yep.
Perfect. Okay. So, I have my handy dandy pen light. Now I'm going to take a look up inside of your nose, okay?
Okay.
Tilt your head back just slightly. Oh. So at this point we're just looking for any type of deviation with your septum, any drainage, any lesions, bumps, lumps, and nothing is noted. So the next thing we're going to do is we're going to take a look inside of the patient's mouth. So I have my tongue depressor and my pen light. I'm going to have the patient say, ah. Say, ah. Good. So you're just going to do an overall visual inspection of the inside of the mouth. Everything looks good. One more time, ah. Good. Tonsils are normal size, soft. Oral mucosal is soft in general overall. No lesions or lumps or anything noted inside the patient's mouth. Everything seems to be normal, healthy, and moist. So the next part of our assessment is we're going to go over the cranial nerves. So we're going to start with cranial nerve 1, which is your olfactory nerve. So that's your sense of smell. So I'm actually going to test your sense of smell really quick. Before I start, I'm going to just assess nasal patency. So I'm going to cover one nostril, and I want you to give me a nice good deep breath in and out. Okay, good. Another one. Any trouble breathing?
No.
Okay, perfect. So I'd like you to close your eyes. Okay, I'm going to clog up, or plug, I should say. Okay, one of your nostrils, give me a nice good deep breath in. Okay, what do you smell there?
Is it mint?
Yep. Okay, you can open your eyes for just a second. Okay, close your eyes again. Now I'm going to have you smell again. Can you tell me what that is?
Alcohol.
Very good. Okay. So the next cranial nerve we're going to test is your optic nerve. So we're going to do this by, we're going to do a quick little vision test with a Snellen eye chart, which I have right here. So I'm going to place it on the wall right here. And if you'll stand just right over here. Okay, I'm going to have you start by covering your right eye and read the smallest line that you can from that distance.
EDFCZP.
Okay, perfect. Now do the exact same thing with the opposite eye. Cover the other eye and read the smallest line possible.
EDEF. Oh, wrong line. EDFCZP.
Perfect. Okay, very good. Okay, you can sit back down. Okay, so the next cranial nerve we're going to test is actually going to be cranial nerve 3, which is the oculomotor, cranial nerve 4, which is the trochlear, and cranial nerve 6, which is the abducens. So we can do this with some field of vision tests. So what I'm going to do is I'm going to lightly place my fingers on your chin. I want you to follow my finger as I move it back and forth with only your eyes. Don't allow your head to move, okay? So this is just doing the fields of vision test with the patient. And so far, she's doing amazing. Perfect. Okay, so next we're also going to assess for Perla, okay? So I'm bringing out the nasty pen light again. I'm just going to have you look straight ahead, and unfortunately, I'm going to shine the light in your eye really quick, okay? So here we go. Good. Once more. Perfect. So patient has Perla, which means that pupils are equally round and reactive to light and accommodation, which just means that your eyes are adjusting how we would want them to, and both pupils are reacting at the exact same time also. So, perfect. Now we're going to do cranial nerve 5, which is trigeminal. I'm going to have you just do a few facial movements for me. Can you clench your teeth? Okay, good. Now can you open and close your mouth for me? Okay, very good. Okay, so we're going to move on to cranial nerve 7, which is your facial nerve. I'm going to have you raise your eyebrows up and down for me twice. Very good. Squeeze your eyes shut really tight. Okay. Now wrinkle your forehead. Your forehead doesn't wrinkle. Okay. We'll do cranial nerve number 8, which is the vestibular cochlear. So I'm going to have you stand up and face this wall right here. So this is called the whisper test. So what I'm going to do is I'm going to stand to the right side of you and I'm going to whisper 2 words. I'd like you to tell me what I'm whispering.
Red and yellow.
Okay, now I'm going to do the exact same thing except with different words on your left side. Green and purple.
Green and purple.
Perfect. Okay, you can sit back down. Okay, so now we're doing the cranial nerve number 9, which is glossopharyngeal, and then we'll also do cranial nerve 10, which is the vagus with these tests. So what I'm going to do is I'm going to bring back out the pen light and the tongue depressor, sorry. And I'm just going to take a look inside your mouth. I'm just looking to make sure that your uvula is midline, okay? So if you'll open your mouth again and say, ah. Very good, and her uvula is midline. The next thing we're going to test is your gag reflex, okay? So I'm very sorry. Okay, perfect. Sorry, I hate doing that to people. And then one more thing, I'm just going to observe you swallowing water, because that also tests these 2 nerves. Okay, good. And the patient didn't choke, so that's exactly what we want. So next we're going to do the spinal accessory nerve. So I'm going to do this, or I'm going to test the patient with this. I'm going to place my hands on your shoulders, and I'd like you to bring your shoulders up. Give me resistance. Don't let me push you down. Good. Okay, perfect. And then we'll do cranial nerve number 12, which is the hypoglossal, and I'm just going to have you do a few movements with your tongue. So stick your tongue straight out. Okay. Now move your tongue side to side. Okay, very good. Now try to touch your tongue to your chin. Okay, very good. I know it's weird stuff. So you did great on all of those. So the next part of the assessment is we're actually going to do I'm going to palpate, percuss, and auscultate your abdomen. So if you can lay on back for me. Is it okay if we just lift up your shirt? And my hands are kind of cold. So what you would want to start with anytime you're anytime you're assessing the abdomen is you always want to auscultate first, because you don't want to disrupt any of the peristalsis or normal bowel sounds by pushing or tapping on the patient's stomach. So what we would do is we would listen in all 4 quadrants. Before we start that, we would actually just do a quick visual examination, make sure that this patient's stomach is smooth, no lumps, lesions, bumps, or anything noted. You haven't noticed a hernia or anything lately, have you?
No.
Okay, good. So then what we would do is we are just going to listen in every single quadrant with the diaphragm. We would listen for a full 2 minutes before we would diagnose that there are absent bowel sounds if we haven't heard any. So we'll just take a quick listen. Then we would want to listen over the liver and spleen. And we're just listening for vascular sounds. So Tara must have just recently eaten, because she has positive bowel sounds in all 4 quadrants. The next thing we're going to do is we're going to listen with the bell of the stethoscope, and we're going to listen to her epigastric area, umbilicus, aorta, and femoral area, just to make sure that there are no bruits. So we'll do that rather quickly. Normally you would listen directly on the skin, but for this purpose I'm not going to listen directly on her skin for the femoral artery area. The next thing what we're going to do is we're going to actually percuss her abdomen. So you want to do it in multiple sites, and you just want to work your way around all the different organs. So we'll just percuss. Sorry, my hands are a little cold. Wow, your stomach's making a lot of noise. Okay, perfect. So I'm going to lightly palpate your abdomen next. We're just feeling for any abnormalities, tumors, masses, anything like that. I'm not going to do any type of deep palpation. And again, I apologize, my hands are cold. Was any of that painful?
No.
Okay, so you can go ahead, pull your shirt back down, and you can sit up for me. Okay, so the next thing that we're going to do is we're going to inspect or assess your thorax and your pericardium. So what you would want to do is you're just generally assessing the patient's breathing. So I'm going to have you just take some nice good deep breaths in and out. So you would want to make sure that the patient's breathing is symmetrical bilaterally. I'm going to have you stand up really quick and just face that wall. So you would want to assess the patient's chest and then raise both arms up for me. And then you're also going to assess her AP diameter. You can bring your arms back down, which her AP diameter is half of her chest, so that is normal. That's exactly what we want. The next thing I'm going to do is assess for any spinal deformities, curvatures, anything like that. So I'm going to lift up your shirt, and then I'm going to have you just bend over, touch your toes, and we're just basically looking to see if you have any curves in your spine. Okay, looks good. Okay, you can stand back up. Okay, awesome. Sorry. So she has no thoracic deformities noted. Now I'm going to have you just sit right back down on the bed. The next thing that we're going to do is, this is when you would just assess like patient's radial pulse and respiratory rate. Normally you would palpate the radial pulse for a full minute, but for this purpose we're only going to palpate for 30 seconds and we'll multiply by 2, and the other half of it we can assess the respiratory rate. You wouldn't tell the patient that you're assessing their respiratory rate because it might change their breathing pattern, but for this we're going to. So. So your heart rate was 80 and your respiratory rate was 16. So the next thing that we're going to do is we would just palpate the patient's chest. We want to start on the front. You want to start up on the shoulder area, and you're just basically palpating the muscles and intercostal spaces to make sure, hold your arms at your sides for me, to make sure that everything is symmetrical and normal. Sorry, hands are cold. Okay, all the way through every single rib. Then what we're going to do is I'm going to place my hands underneath your chest, and we're going to measure chest exertion. So I'm going to have you take nice, good, deep breaths in and out, and you just want to watch your thumbs move symmetrically apart. Okay, very good. Okay, so now we're going to do the exact same thing on the back side. We would just want to palpate all the way down, all throughout all the ribs. Then we're going to come back, and once we get to about the 10th rib, we're going to place our hands exactly the same way except on the back side and do chest exertion back here, so nice good deep breaths. And my thumbs are moving equally bilaterally, so it's symmetrical. Very good. Okay, now I'm going to assess for tactile fremitus. So I'm going to place my hands on your back, and I'm just going to have you say 99 a few times.
99, 99, 99, 99, 99.
Okay, perfect. So the next thing that we're going to do is we're going to do some percussion on the back. So when we percuss on the back, we're wanting to percuss to make sure that we're hearing normal sounds. We're going to percuss about 10 spots on the back to start out with, and you would want to start at the left upper or up high, and you want to work left to right systematically. So okay, perfect. The next thing we're going to do is we're going to percuss lateral chest, so I'm going to work side to side. You would want to do this in a systematic manner too. Also, you want to do 4 spots on each side. So. Okay, perfect. Everything sounds normal. Finally, we're going to do the front last, okay? So we're going to do the exact same thing that we just did on the back, except we're going to do it on the front. We're going to want to start just above the clavicle. So here we go. Okay, and everything sounds normal. So the next part of the assessment, we're actually going to auscultate the patient. We're going to auscultate in the exact same spots that we just previously did. We're going to listen with the bell of the diaphragm of the stethoscope first, and then you would listen with the bell. For time purposes, we're only going to listen with the diaphragm. So I would have the patient take nice, good, deep breaths in and out, and I would want to listen 10 spots posteriorly, 4 spots each side laterally, and 8 spots anteriorly. So if you'll just continually give me nice, good, deep breaths in and out, Tara. Okay, we're going to work around to the front. If you can place both arms at your sides, I'm just going to listen to laterally. Okay, and then we would just listen to the front in the exact same demeanor. Okay, so for the next part of the assessment, actually we're going to do one more thing on the back side really quick I forgot to do. As I auscultate in the back, I'm going to have you say 1, 2, 3 over and over and over. And this is the whisper pictorially test. So
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, perfect. So, for the next part of the assessment, we're actually going to assess the patient's heart sounds. So what you would want to do is there's 5 standard locations that you want to auscultate with the heart. So the most important spot is the mitral valve or apical spot, which you would want to listen to for a full minute whenever you're auscultating. But we'll get to that spot here in just a little bit. So there's landmarks for every single spot. So the first one we're going to find is the aortic area, and that is on the right side of the sternal border, the second intercostal space. So you would palpate down intercostal spaces. I'm going to have the patient take a nice good deep breath in and hold it while I'm listening. Okay, you can release. And at each spot, you're going to want to listen to S1 and S2. If you hear any other abnormalities, you can go further with your exam. The next spot we're going to listen to is the pulmonic area, and that is on the left side of the sternal border, just directly across from where we were at, the second intercostal space. So, again, I'm going to have you just take a nice good deep breath in and hold it. Okay, good. Now we're going to move down another intercostal space, so we're going to be at the third intercostal space. This is the second pulmonic area, and we're going to sew the third space down, but the second pulmonic area, a nice good deep breath in and hold it. Okay, then we're going to go down another intercostal space, which would be the tricuspid area, and it's just left sternal border again, so a nice good deep breath in and hold it. Okay, and then our fifth spot, we're actually going to go fifth intercostal space down, left mid-clavicular, so you're going to move more midline on the left side. And this is the mitral valve or apical area. You would want to listen for a full minute here and then reveal the heart rate, but we're not going to listen for a full minute. We'll listen for about 30 seconds, so for time purposes. Okay, heart rate is 68. So now we'll move on to the next part of the assessment, and that will be palpating peripheral pulses. So what we're going to do is we're actually going to start with the carotid pulses. You're going to want to palpate one at a time because you don't want to palpate them both at the same time. So we'll first find the one on the left, easy to find, then find the one on the right, easy to find, and they're both +2. And then you're going to want to listen with the belly of your stethoscope for the carotid pulse to make sure there's no abnormalities as far as bruits. And none are heard. Then we're going to move on down and we're going to do the brachial pulse. So if you can extend both arms out, you're going to find one at a time. Brachial pulses are on the inner aspect of the elbow. If you basically follow the ulnar bone straight up, they're just right in here where the arm bends. Okay, good. Good, and hers are both +2. Next we're going to move on down to the radial pulses. This would be another good opportunity to palpate the radial pulse. You would palpate for a full minute, but we already know her heart rate multiple times during this assessment. Okay, and those are both +2. So now I'm going to have you lay flat for me. I'm going to assess your femoral artery pulse, which is very low down. It's basically near the mons pubis, where the mons pubis area meets the groin. So you would just lightly palpate. And the femoral artery is usually +2 to +3. It can be stronger than the other pulses, and hers are easy to find. Okay, good. So now I'm going to have you roll over and I'm going to assess your popliteal pulses. So if you can lay on your stomach, you would lightly bend the patient's leg up, place your fingers in the popliteal space, and just feel for the pulse. Okay, good. Now we're going to just do it with the other leg. Okay, good. Okay, you can roll back over, and if you want, you can stay in a laying position because I'm going to do the pulses in your feet. Both the popliteal pulses were +2. So next we're going to go for the posterior tips. These can be a little bit more difficult to find. They're on the inner aspect of where the heel is, and hers are actually very easy to find. Okay, and then we're going to go for the dorsalis pedis. Okay, good. Good. Both +2. Okay, so you can sit up. And for the final portion of the assessment, we're just going to do some balance and coordination. First, I'm going to have you take your hands on your thighs, and I'm just going to have you lightly tap back and forth in a slow motion. Okay, now speed up. A little bit faster. Perfect. Okay, you can stop. So there we're just assessing that the patient has coordination and can do equal movements at the exact same time. Next, I'm going to have you take your fingers and go 1, 2, 3 like this. Touch your thumb to your pointer finger, then middle finger, ring finger, and then pinky, and just keep doing that over and over and over, and gradually get faster as you go. Okay, very good. Okay, so the next test we're going to do is the Romberg test. I'm just going to have you stand up for me. Stand with your feet apart. I'm going to have you close your eyes, and I'm just going to assess for swaying. You would have the patient stand for about 5 to 10 seconds. Patient doesn't have any swaying, so she's good. If you noticed outward swaying, that would be an indicator of something. You can open your eyes. Also, you can have the patient stand on 1 foot at a time with their eyes closed and assess for 5 seconds there too. So for the final part, I'm going to have you do the heel to toe test. So I'm just going to have you start over here, and I'm just going to have you walk heel to toe with your eyes facing forward to this wall, okay? And this is just to basically check to make sure that the patient has good balance and coordination. So, and Tara does. Tara's rocking. So, okay, now turn around and go back. Okay, perfect. So our assessment is complete today. Tara, do you have any questions for me?
No, I don't.
Perfect. Thank you.